Hello, I'm Kevin Dolan, Alliance Director for Microsoft's Health and Human Services Industry Unit. Our alliance is comprised of industry-leading partners who are committed to delivering a vision of breaking down silos of government and health and human service delivery that have inhibited access, quality, and efficiency, and outcome improvement. And these partners work to deliver frameworks of solutions that, again, help break these down. And today we're joined by one of Microsoft's longtime leading partners, Jim Townsend, InfoStrategies. Also, you'll hear it known as InfoStrat. Welcome to the show, Jim.
Thanks. It's great to be here, Kevin.
Well, tell us a little bit about your business and what you do and the history of InfoStrategies.
Well, we've been around for 22 years now, focused on delivering public sector solutions on the Microsoft platform. We've worked with federal government, we've worked with state and local government, and in the healthcare vertical in particular.
Great. Well, tell us about what you've been doing recently with your program, and specifically how are you breaking down the silos of care and service delivery?
The innovation that we're most excited about is Microsoft Dynamics CRM. The product is a fantastic platform for building line of business solutions. In fact, we've come up with a new name for it. Microsoft has XRM to indicate that CRM is not just about customer relationship management, but all kinds of relationship management, if you will. Solutions that deal with people, that deal with transactions, and a number of government scenarios. For instance, in healthcare, one of the most common situations is case management. We have lots of types of case management. Clinical cases, of course, all patient matters.
Right.
And CRM, right out of the box, gives us lots of tools we can use to build solutions better.
Now, when you say right out of the box, traditionally the approach to case management has been siloed programs that have been driven by each individual program, whether it's child welfare or child care or Medicaid or mental retardation or numerous programs. So how have you worked to break down those unique case management tools that caseworkers have to navigate?
Well, I think you're correct that the traditional approach has been custom application development. And with custom application development, you start with a blank sheet of paper. You gather requirements from the users, you write each line of code by hand, and it's an expensive, time-consuming process. So many of our customers have ended up with two categories of solutions. They've got custom solutions that large integrators build over multiple years, multiple millions of dollars, and then they have departmental solutions that end up being built in Office tools like Excel, even for database applications, or Microsoft Access. And this CRM provides us with a third path, a way that we can build solutions faster but be enterprise quality. Instead of starting with a blank sheet of paper, we're using the built-in features that we get, as I said, out of the box. A rich data model, a user interface that's familiar to users. It's very similar to the Outlook user interface. Integration with tools like Office that are familiar to the users, so we get better adoption.
And what kind of user interfaces do you have then besides?
There are really three user interfaces for our solutions. The first one is through a web browser, so that's a lightweight user interface that's available on a lot of different platforms. The second one is Outlook. Microsoft Outlook has an interface into these solutions, so without leaving Outlook, you can navigate directly to the solution and do data entry, do reporting. The third one is your mobile client. Your cell phone, your Pocket PC, even your BlackBerry, you can use to get into this data in the solution.
Especially useful for caseworkers who are out working in the field with their clients.
Exactly, and devices like a tablet PC that are mobile.
Well, Jim, it seems that you've developed numerous applications over the past few years, very different ones. And what are your customers saying about the ability for you to use one tool but develop multiple different capabilities from public health to social service delivery?
We're getting a great response from our customers on this, and we found that once we build the first solution, and we typically build a solution around 90 days and not 3 years, once we build the first one, then we end up expanding it into multiple solutions. Some of them have even compared it to a Swiss Army knife because they can save so much time and technical risk by building on top of this XRM platform.
Great. Well, there you have it. Thank you, Jim, very much for joining us today. As one of our Connected Health and Human Service Alliance partners, we're very grateful for the work he does, collaboratively working with our other partners to deliver these efficient programs that are effective and help improve the access, the service delivery, and outcome improvement for health and human services. Thank you, Jim.
Thank you.